This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today, I'm thrilled to be speaking with our guest. She's the founder and owner of Complete Eye Care of Medina, a Minnesota practice she co-started in 2008 and built into one of the most recognized independent offices in the state. She holds an OD and a Master's of Science from Ohio State. She's a fellow of the American Academy of Optometry, and she was named one of the most influential women in optical by Vision Monday readers. She's a member of the Intrepid Eye Society and frequent educator on contact lens technology. Please welcome Dr. Gina Wesley. Gina, welcome.
Thank you. Thanks for having me today. I appreciate it.
Yeah, you've got such a cool story. I'm excited to kind of dig into it and find some root causes of success. So with that, what was the most important thing that helped you grow your empire?
Well, I think in my very early days of starting to practice, I realized that there was a specific way that I thought patient care could be experienced, and that it might look a little different. It might be something not in the mainstream expectations of what you experience as a patient or know as a practice owner. And with that in mind, I decided to start my practice and move forward and put forward some tenets and practices that maybe were a little less common, a little unusual. And that's what helped launch my practice.
Yeah, it's almost like, so what I'm hearing is like instead of zigging, you zagged a little bit.
That's right.
What were some of those things that you did that were like, hey, maybe people were saying go this way, but you went another way?
So when I started my practice in 2008, it was an interesting time with the financial, housing crash and all of that, but I really only had nowhere to go but up. And so some of the things I implemented were some slightly different practices when it came to contact lenses and contact lens fitting. And I actually moved forward and started to do a lot more daily disposables in my practice before there were a lot of options for daily disposables in my practice, or even just in general to prescribe. I also looked at the patient experience, and I started really analyzing not only what it would take to be successful, but who I could partner with to help me in that success. And I think those were very key sort of pillars that I prescribed to help me grow my practice and move in the direction that I wanted. And as you and I have, talked about prior to leading to this podcast, it led to some interesting decisions.
Yeah. So share with me some of those decisions. I'm curious, what were some things that were sort of counterintuitive? Tell me about that a little bit.
So when I started my practice, and I always like to tell doctors this, I did take a number of different vision plans in my practice, some of them for not very long, but I had two solid vision plans that I had within, I had started my practice, but by about 2015, I had bought some land and built my own building. So my practice was about 6 years old at that time. And I had an experience where I had moved communities just a few miles away, but I was switching over to a different dentist. And I went into their office, and I don't have dental insurance. I've always just paid out of pocket. And I noticed that they had a really nice group plan for like individuals like me that don't have insurance. And I was like, well, this is kind of slick. I'm like, I think I can do this, right? Because we do have patients that are private pay. And I happen to have a few in my area. And I was like, well, why not give them something that benefits them? You come in, and I'm like, absolutely. We can give you not only an eye exam, but you're going to get XYZ benefits to go along with it. And so with that, I implemented that in my practice. So that was about 2014, 2015. And so we called that the VIP Club. And at the time, the one of the two vision plans I had was only 10% of my patient population. So I decided to just drop it. I was like, I don't think I need this, because I had an experience where a patient, it was one experience that highlighted maybe what was happening throughout my practice. I had a patient who understandably was somewhat confused about their benefits through their vision plan. which we all are. I mean, and we work with it every day. It is hard to understand. And we had come across a situation where we had overcharged a patient. And so we had done the right thing in sending them a refund after we had done the calculations and realized I think they had overpaid for something with their glasses. Well, instead of the patient being appreciative, they then started to question every interaction that they had had with my practice over the last many years, called the executive director of my state association to complain about our practice and say, hey, what's going on with this practice, right? All of these things. My executive director, who knows me very well, talked them down, but she called me and she was like, you need to know that this happened. And I was like, why am I allowing an insurance plan to dictate my reputation? Because I'm trying to do all the right things. Patients look at me and I am their vision plan, right? They don't see that as a separate entity. And that realization and the experience at my dentist's office made me create this plan. I was like, I'm going to drop this. And I was like, out of all of those patients, as I averaged the revenue, because I have more of a high-end practice in the services that we provide, I was like, I think we can really lose about 5 or 6 of these as long as we keep, one out of every 5 or 6 of those patients will be fine. And fortunately, this was a plan that also had a lot of patients that had major medical coverage for routine care. So that helped in that transition. And so we did that, never missed a beat, didn't feel it at all. Of course, patients were a little disappointed, but there's people that go and there's people that stay. And that's something that is totally fine with me. As you realize what direction you want to move in, I believe you become much more at peace with those decisions. So that was a major step in the kind of forward movement of my practice at that time. So practice would have been about 8 years old at that point.
You said something really insightful. I've never heard anyone say, but it's so true, that the doctor is the vision plan. That's how the patient views it. That's brilliant. I'm not gonna lie. That's really, and I'm gonna use that one again.
Oh,
that's smart.
Absolutely. Yeah. Go for it.
Yeah. So let's dig into that a little bit and understand if someone wants to replicate this, to understand the circumstances and the system that kind of lends to that. Because I'm curious I'll ask this question and frame it this way. If I'm in a very competitive city, urban center, where there's literally Walmart, VisionWorks, Costco, LensCrafters, Sunglass Hut, Target, you name it, within a stone's throw of me, and I'm trying to be competitive, I need access to patients. And so insurance companies drive people to my door. When you were going through that, did you have that level of competition? How do you differentiate? How do you still get people to your door? Because honestly, most offices rely on insurance as their marketing, as their driver. How did you switch it? Or was it that big of a problem? Like, talk to us about that journey and how it might be different with someone more competitive environment.
Such a valid point, and something I always like to point out to doctors is that I could not have built my practice without starting with vision plans, because I was a cold start. I needed to build my reputation, and the vision plans helped me to do that. But here's the great thing about vision plans is that they change. You might not have the same vision plan or insurance this year as you do next year. And so creating that patient loyalty and knowing what they get when they come to Complete Eye Care in Medina versus if they dabble and go somewhere else was a huge differentiator. So I know everybody thinks that they do a wonderful exam and everything's great, but I really always ask people, are you willing to do the things that others are not in order to make you set yourself apart? That's what we have done at my practice with the steps that we've taken. And I've always looked through it from the lens of, what would I want as a patient consumer? I'm a patient consumer. I go to the doctor. I go to other, sort of specialties for my own personal care. And I'm always thinking to myself, what could I have done differently there? What could they have done to have made this process smoother and better? And there's always something. And so if you continue to ask yourself those questions through that lens, I think that would help you to set yourself apart. We also offer some specialty services and have really become experts in that. We've been doing myopia control for 15 years in my practice. We've been doing dry eye for, a dozen years, high level specialty before there were all these dry eye centers of excellence. It's an excellent part of the service that we provide. Right. So I always tell doctors, I was like, and I admire people who go out and they just don't take vision plans from the start. That's amazing. You really do have to have some sort of an edge or really be heavy duty into marketing to allow your patients. But I am always pleasantly surprised at how many patients who are out there, they're looking for convenience and they're looking for excellence. And those two things marry very well with offering a private pay plan option for your patients. Just make it easy. Make it easy for people to understand that choice is always theirs. And I think you would be surprised at how much less competition, because people don't necessarily, there are people who 100% want to go and have a very cost-effective exam, and there's nothing wrong with that. That is always their choice. But there are enough people that really value their eye care, their eye health, their products that help them to see and thrive every day, that I think that's why the private pay plan works in my practice.
Got it. I love that. And I think you said on some interesting things that, hey, you use it to build your business, but not drive your business afterwards. You had that reputation. And so I think those are some important things to take in mind. And so as you're growing, you went from deciding not to take the plans. What did you run into that you didn't expect? What was surprising?
So, we hadn't really gotten to the part where, I dropped that smaller vision plan, but I still had one plan that ended up comprising about 35 to 40% of my patient base. And it was very frustrating. So something that I invite doctors to look at, because we always seem to focus on the reimbursement to the doctor specifically for the services provided. And I know you can be very successful. I have many, many more colleagues than not that take vision plans and do very well with them. But you do really have to know what you're doing in order for that to happen. And so as we move forward through everything, I always like to look at the administrative side of the vision plans, because this really came to a head in COVID. And COVID was the start of maybe some staffing challenges, meaning that you didn't necessarily have the staff you needed to be able to operate. The demand was very high, as we all knew at that time. People needed eye care. And so I was like, oh my gosh, I actually literally started adding up the time spent by my staff to administer a vision plan, verification of benefits, not to count the lengthy conversation on the phone that might need to be had with the patient regarding their vision plan and how it works and some of their benefits before they even get to the office. Explanation of what is covered or not covered as they get to the office and they enter into testing. The discussion with the doctor, options thereof. You are going to the optical. Do I do contacts? Do I glasses? What are my benefits for glasses? What about this? So many scenarios. Oh, by the way, that's really confusing. I think I'm going to need to come back and bring my spouse to help me make this decision. You have another visit to help walk through. Then you have to submit the claim and you have to enter everything in. And then you have to get the reimbursement back and try to figure out and navigate what all of the chargebacks and write-offs are. And it's very convoluted, I believe, for a reason. And when you really start digging deep, you're like, oh my goodness, I decided, as you know, and this is one of the reasons for the call, to drop that final vision plan. And I rebranded my private pay plan. And in 2022, that was our first year of not having any vision plans. And so this was obviously a really big step. It took me years. I never thought I would do it. And we did it. And so I lost, I believe, one staff member due to some family circumstances. Didn't replace her, didn't need to. And then we had another staff member move on, didn't replace and didn't need to, right? So it was one of those things where I definitely said to my staff, I'm like, I'm not letting anybody go, but I know there's going to be less work. And as people there's some natural attrition there, I found that, gosh, we really just didn't need that element. And so I always invite practices to take a look at that side of things, and perhaps you do it very efficiently and very well, and there's no issue or problem. But for practices that maybe aren't as well staffed or have the expertise, that admin side, the hours spent by staff, is something you should add into the calculations of, is this plan worth it to take in my practice?
Yeah, that's interesting. And one thing I want to just draw is you started in 2008, but you didn't get off of all plans until 2022, and that's all vision plans.
Correct.
So even then, it was a journey. So
Yeah.
I think sometimes we look back and it's like, oh, it's overnight success. Like, yeah, overnight success that took 20 years, right? So,
Exactly. Exactly. No, that was definitely, it took time, and I was pretty nervous about it. We had assessed, and I said our goal was to keep 4 out of every 10 of that specific plan patients. I was like, if we can do that, I think I would be pretty happy. We ended up after that first year, I think we did like 3.7 on average. So we were close. And then we stopped tracking that stat just because, but I will tell you this, remember that was 35% of my patient base for all comprehensive exams was that vision plan. That year, I think we saw about 15 to 20% less appointments, but my revenue was only down a couple percentage points. And the next year we were back up and thriving even better than what we had done in 2021. So it's not, if you can be diligent and try and replace this. And I always tell practices too, I was like, you will lose patience, right? You will have people that no matter how you deliver the information, they take it as a personal affront that you no longer take their vision plan because they want to see you, but they don't want to see you bad enough that they're willing to forego and self-submit or do another varieties. And we did at that very first year, we offered a variety of options for our patients. We started telling them that this was something we were planning on doing. And we said, you can submit to, self-submit. We brought in one of the services where you can get the benefits reimbursed to you there. You can use your major medical, or you can do our private pay plan, right? So we had options for people and we educated them, and a lot of people left and a lot of people came back. So that was something that was also really nice because they did realize what they were missing when they went somewhere else that they did not get, that they get.
Gotcha. That's interesting. And so I'm guessing, are you still using some of those services? I guess like Anagram or whatever is out there. No,
we tried that first year and it just wasn't received. It just didn't work. And I know it works really well for other practices, but I think it was because we had that private pay plan for so long that so many people just opted to go into that it ended up being a moot point for us. And so I'm happy that we had it as an option, but we no longer utilize that in our practice.
Interesting. And as far as, I've done the math before. I think it's roughly, so if you make, I think it says something like, this is usually on price increase, right? But it's the same kind of math, right? So you're going to be making more money per patient because they're paying you directly. If you make 20% more income, you can lose 22% of your patient base and still come out ahead. So it's like a formula there. And it's the same thing's true. Like it's like a 10% add-on, right? So if you raise by 50%, you can lose 55% of your patient base and still make it back. So it sounds like you were shooting for about a 25%. So it sounds like it's about a 20% to 25% loss based off the numbers that I'm hearing. And so you lost about that many, a little bit more than that, but you ended up being close to break even. So it sounds like that's sort of roughly what you can expect in drop in income, but increase in per patient is about a 20 to 25% increase in per patient, but about a 25, 27% drop in patient base.
Yes, that sounds about right. As I analyze our revenue per patient numbers, that's spot on actually, which is really, really interesting. And something else I'd like to point out is that very first year in optical, we sold 1/3 as many pairs of glasses that first year without vision plans as we had done the previous year. But our revenue and what we actually kept was the same. So write-offs are real, chargebacks are real, and it can be very like smoke and mirrors as to what that number adds up to. But again, it's just awareness, right? Is to like, you really can have more success and flexibility than you think if you want to. And I know a common complaint I get from doctors, they're like, oh yeah, well, you live in an area where maybe that's a little bit more accessible. 90% of patients are covered by vision plans where I live. And I'm like, yep, I probably wouldn't have made that decision maybe then if I lived where you live, right? So there's going to be regional differences. There's going to be urban versus suburban. Our practices that are in more small towns have a ton of flexibility, right? With, I think, being able to choose or not choose to do that. So it does vary. And I'm not here to tell people that everybody should do this, because I don't think everybody should. But it has been a great decision for my practice. And I'll be honest, it's really nice to go to work and see patients who want to be there and choose to be there. And now about almost 40% of our comp exams are our.
Wow. And you do take medical, so I'm guessing your medical providers also provide
Yes.
vision, comprehensive coverage.
Yes.
Yeah, so that helps a lot. And are you in a state that also has opt-in or opt-out for the labs? So meaning if you're an IMED, you could potentially opt out and do your own edging and things like that? Or your own labs, or do you have to do
Yes, that was an option. And now, honestly, I'm so far removed. I don't know anymore, but I'm pretty sure it is. I know. I'm pretty sure it is, because I have friends and colleagues that have their own in-house.
Well, I was thinking that that if you have to use their labs, that even makes it more, changes the math even more, right? Because there's not an option. You don't have the extra lever to pull out. You are going to get charged back, so you're fixed in terms of what you charge, and that's it, right? There's no variation there. That's interesting. So let's talk a little bit about some of the things that are challenging, right? Reimbursements, obviously, from the medical side, but I guess you don't really have those from the vision side. But from a medical side, are you pretty heavy medical practice?
We do. We do, we do a lot of medical, glaucoma, dry eye, office visits, emergencies, diagnostic testing. So yes, we still have that side.
Gotcha. And so are you having challenges with reimbursement? Or you've kind of been able to manage and work that pretty well with your mom?
Yeah, so that is definitely something I'm always watching and monitoring, which is another reason why I've decided to grow a lot of our cash pay services, because that helps us to control a little bit more with that. Yeah. Here in Minnesota, there has been definitely more auditing, looking at numbers. I am on panels. I'm fortunate, I'm on all the major medical insurance panels. But for instance, we had a senior plan called UCare that just went financially under this last year. And we knew that they were going to stop offering this plan, but they didn't tell us that they were going to stop paying us the last month that the plan was there, right? So those things matter. And I'm a small practice. I feel for these hospital systems here in Minnesota that really got left behind because of millions of dollars in reimbursements that they don't know if they'll ever see or not. So, but that's on a small scale. So that's probably been the biggest challenge. Obviously, we have all seen that reimbursements have gone down in many cases, and it is something we monitor, right? Like annually, I'm looking and seeing like what people are paying, what we're charging. You can't help but think like, are there a medical plan or two, and we have done that, right? So there are some miscellaneous medical plans that we no longer accept in my practice because it was just too difficult to get reimbursements. So having dropped all vision plans, it gives me the confidence to pare out maybe some of the other plans that I'm looking at now that are hard to work with, hard to get paid from. And we give patients the same option. We're like, hey, here's the deal. We no longer accept X, Y, and Z. They're very difficult for medical reimbursement. You are welcome to submit on your own. We will give you everything that you need to do so, but you will pay us, out of pocket for those, charges. And so that's something that we've been doing more of, because I have to run a business. I have staff to pay. I have overhead. And sometimes, patients will be like, why don't you, accept that plan anymore? They're in my chair, but they're still a little mad about it. And I simply tell them, I have to run a successful practice, and I want to reinvest in all the technology that you appreciate and why you're sitting in my chair and all the things we do to make this a wonderful, comprehensive, complete experience. That takes investment in people and resources. And if I can't afford to do so, then you won't get that benefit. We won't continue to grow. And those are things that are not acceptable to me. Those are things that I want to always keep moving forward and always keep improving. And so very candidly, I need to be able to have the financial resources to do so. And that does sometimes make me make some difficult decisions. It's not personal, but it is something, right? Yeah. So, yeah.
Okay. Yeah, that makes a lot of sense. And as far as, let's talk about staffing is the other challenge.
Yeah.
Are you still facing staffing challenges, or is that kind of
Yeah, no, staffing is always a challenge. And as you, of course, know, you can be resourceful and creative as to how you staff things these days, which I love. That has been a game changer for us. I love getting things out of my clinic and off our table and onto competent hands that help us to be very complete. So that has been probably the biggest boon. We have 2 full-time. We actually are hiring a 3rd full-time assistant and potentially looking to hire more. Something I didn't mention, but I know you know, is I do a bit of clinical research in my practice as well, and that's outside of my practice. But I staff for that, and that's another area that helps support my other staff if need be. So we are always trying to be creative. So yes, I think staffing will always be an ongoing, challenge. We're always looking, for competent staff that are wonderful people, but attrition does happen for a variety of reasons. And I think more so now than ever, you don't always get the long-term loyalty that had been expected, 20, 30 years ago in this profession. I think that there's a little more movement, in my opinion.
Yeah, I think so. I think this was a few years ago. I think the average tenure was around 18 months for a healthcare employee, and that's across all healthcare. So not sure what it is now. Might be shorter, might be longer, but I imagine it's around there. It's probably not.
That actually makes me feel a lot better about my staff for how long they've been with us then at this point, because you do think, wow, that's difficult, but I get it. So we're always looking. We're always ready to hire a great person and figure out how they could best fit with us.
Makes sense. So what is it that you're looking forward to? Are you looking forward to, for you both personally and professionally as an industry? Like, talk to me about what you see on the horizon that you're excited about.
So on the horizon, obviously we can't ignore AI and how that's going to play a big role, I think, in how we deliver care. I think that we are still going to be necessary parts of that, given the work that we do, right? It's going to be hard for AI to solve all eye issues and problems. We still need a person in there, but I think AI can be a really great tool to help us in our day-to-day, and it already is for me in various aspects of running my business. I utilize AI as almost my personal advisor, asking questions, trying to come up with plans, helping to summarize patient data. There's just so many, as you know, applications. So I think that it's not something to be feared, but something to be embraced, and just trying to stay on top of that. I look forward to the efficiencies that will bring. I look forward to the advancements and advanced scope. I think it's going to be, we in Minnesota, thankfully, had just passed an increased scope law here about 1.5 years ago. Great for what I'm able to deliver, especially as it comes to my dry eye treatments. And I think it's going to be a necessary expansion based on the patient need and lack of ophthalmology that is coming through. So I look forward to how that will service our patients and what opportunities lay for us as doctors to be able to deliver better and more comprehensive care to our patients in a timely fashion, right? I think that's really the key, is that we don't want people waiting and having issues and problems because of that.
Yeah, I think those are both pretty common things people are excited about. So expansion of scope is definitely something we're seeing. I think there was some talk about that at AOA too, in state by state. So it's kind of interesting to see that. So let's shift gears a little bit. Tell me, Gina, what story made you who you are today? So it could have been something in your formative years when you're younger, it could have been more recent, but something that really sticks out and says, yeah, that made an impression on me, and kind of why I make decisions today was impacted by that experience.
Gosh, I think some of the biggest impact is my fortunate early exposure to some wonderful mentors in this field and people who have helped guide me as I've moved along in my practice. Kelly Nichols is my advisor at Ohio State. She's done amazing things and has connected me with a lot of leaders in the industry. Ben Gaddy, Paul Karpecki, and I've met wonderful other people. Carrie Geed, you had Carrie on your podcast. I just have some really wonderful connections, which has helped me to navigate, right? You meet these people, and I think that's the most wonderful thing about our profession, is it's small enough, it's a small enough industry that you really have the opportunity to expose yourself, if you choose, to different ideas, new people, and exposing me to consider ideas and practices that maybe I never would have had I not been around them. So I think those formative years, but I also think putting yourself out there is a big deal as well, and making sure that you are trying to always learn and gain information from a variety of different platforms and resources and ask questions, right? Being curious. Those things have always helped to form the person that I am. So I've been fortunate not only to be a part of Intrepid, as you had mentioned in the intro, I'm also a part of the Alpha Omega Consulting Group. And so just wonderful, knowledgeable people who bring a breadth of experience. And these are things that are accessible to most optometrists, right? Through a lot of our education and platforms, blogs and articles. There's so much out there. So I think those, connections were probably some of the most formative things for me that has made me the person that I am.
Yeah. That's awesome. It says, I think there's an African proverb that says, if you want to go fast, go alone. But if you want to go far, go together. It kind of reminds me of that, right? Like your connections and your surroundings of people that you go with help you kind of build on what you create.
Yes, I love that one. That's a great one. I've definitely heard that one before.
So if you had to give your younger self advice coming right out of optometry school, so let's say it's a week after you graduate, what advice would you give your younger self?
Have an idea about what you want to do and be willing to know and understand that is going to probably look completely different in the next couple of years, right? So I always thought, I'm going to do XYZ when I graduate. I'm going to be, join a group practice. I'm going to buy in. And none of those things happened. I never ever thought that I would be the person that would be opening a practice cold and starting things up, but I did. And I thought that my practice would, when I started my practice, I had a vision for what it was going to be. And then I pivoted and things changed and I got involved in clinical research, and that was super wonderful. And I was able to do some lecturing, and that was really fun. And then as I had a family, and as I tried to become more flexible, my practice today, I would never predict that this is how it would look when I started now 18 years ago. So it's, I would just be flexible would be the advice I'd give my younger self, and don't be afraid of change. And I do, that's something when I hire people in my practice, change is hard and we know it, right? We are creatures of habit. But when I hire people, I warn them, I was like, you got to be ready because this practice is always changing. We're always growing and doing something new and different. And if that's hard for you, I just want to be very candid. This may not be the place for you to work. And I say that and people are like, yep, no problem. It's not a problem. But I have literally had employees move on because they're like, I just want to come to work and do the same thing day in and day out. And I don't have to deal with doing something new or different. I need the employees who are like, oh, that's exciting. I was kind of getting bored. Let's do something new. Those are the people that I like. So I really try to give a very big heads up when people start to work for me. And then when they struggle with it, we're like, remember when we talked about this in your interview? We talked about how we are and who we are at Complete Eye Care. This is, and like, yes, I know. And it just turns out that, that is not the right fit for everybody, but that is something that we are.
I love that. So if people want to reach out to you, Gina, where can they find you?
So they can find me. I'll give you my connection information so you can put that in the show notes. But we're on social. We've got our website out there, cecofmedina.com. Complete Eye Care Medina.com is what that stands for. You can find me at all of those places. Yeah.
Awesome. Yeah, well, like I said, like you said, we'll put that in the show notes for people to get connected with you, to learn more about your strategies, or just get help, or just to talk shop. So
sounds good.
And thank you. Gina, thank you again for being on the show today.
Thank you, Ankit. It's so nice to be on, and thank you for having me. So honored. You have a wonderful podcast. You've had amazing guests, and so I feel very fortunate to be one of those people.
Well, I took away some real good nuggets from here. So I got two things from this. One is one of the last things you said, actually. You have a culture of innovation that you're obviously trying to push the bounds, which probably enabled you to be able to move off of the insurance panels over time because of that culture of innovating, trying, and adapting. In addition to that, I love the insight we talked about earlier. The patients see you, the doctor, as an extension of the insurance company, not separate from it. And then the third thing you kind of mentioned there that we didn't touch on, but I picked up on was anytime there's an issue of like a not understanding, which happens a lot with insurance companies, it breaks that trust and breaks that relationship. So it's almost like you're making it harder. They're playing defense against you almost at times because it's so confusing, and the patients are like, well, why do I don't trust you anymore because I don't understand this.
Confusion is always the enemy, and so clarity in everything we do is a definite great summary.
Well, and thank you, audience. If you learned something or laughed, please share the podcast with a friend, and make sure to hit the subscribe button so you never miss an episode. And if you look at the meeting link in the show notes, if you book a meeting, I'll send you a free copy of my book, Optometry Redefined. Thank you again, Gina, for being a guest. And this has been another exciting episode of Optometrists Building Empires. We'll see you next time.
That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.